Okay, so like I said, my name is Scott Morris, and I'm here with Zahra Alsafi, and we are presenting mostly about Zahra's work. I'm going to give a brief intro and then turn it over to Zahra, who will be doing the most interesting stuff. So, our project is about public health. In preparing to be one of the advisors for Zahra's project, I had done a lot about zines generally, but not about public health specifically. So I have been researching zines as a public health tool and trying to make sure that we know, like how it can be used. So first of all, zines as a public health tool are excellent because they provide an unmediated space for the discussion of health challenges. That they are a way that people who have various conditions or health challenges of any sort can speak among themselves, which leads to building a community around health challenges, as well as, of course, the destigmatization of various health challenges. And this especially is true when, well, I'll be more clear when I share some examples. And then next one is that zines, because they are so much better, not better, more engaging, more interactive, more accessible than much of the official public health literature that is out there, is that, so they become more accessible, they become perhaps more usable, though perhaps not as technical or as thorough necessarily. So I have some examples. These are just ones that I pulled from my collection that span a range of issues and healthcare concerns, public health issues. So this is an old one from the 80s with ACT UP, zines about AIDS, both that have stuff about how to deal with AIDS, whether you have it or prevent it, but also demanding that the gay community receive healthcare, which was a challenge in many communities. And then the rest of them are more contemporary ones. This is from a comic or an illustrator I really like called "You're So Sexy When You Aren't Transmitting STIs." It's a very cheeky take on, as I said, safer sex, and it's illustrated. It's got lots of really funny comics in there, but it's also very descriptive, and it covers a range of STIs generally. Here is one called Fat Self-Care. This one's actually a zine game. You play as a fat person going through your daily life, and the author of this one has specifically stated that they are attempting to destigmatize fat people, as well as allowing for a game that specifically has non-binary characters, characters with disabilities, etc. All of which is very well portrayed in the lovely illustration, even on the cover, and the illustrations throughout. This one is "It's Okay to Be an Addict," affirmations for folks struggling with addiction. This one is very personal in nature. The writer is personal as she writes it, but just trying to make sure that, again, mostly as a building a community. Here's "Making Friends with a Moon Cup," with feminist, has a very feminist take on public health, destigmatizing something that I know in a lot of communities, periods and menstruation generally are not always talked about. So a fun little comic to make it easier to talk about it. Things I do to self-soothe, again, a personal one with mental health. This one is the testosterone survey. This one is specifically, it's a study that the author did interviewing trans men about their reaction to testosterone, as well as the availability to get it, healthcare providers, stuff like that. And then this is the one that got Zahra and I thinking. This one was published on NPR as part of NPR's coverage about COVID. And it's a zine about if you're feeling nervous about going out, as COVID was kind of in that middle phase where people didn't know what they wanted. So that's the one that got us thinking about public health. So these are just a wide range of some of the examples, mostly current ones, contemporary ones of the type of public health issues that people are taking on via zines in a range of styles and a range of topics. So with that, I'm going to turn it over to Zahra. And Zahra, I have the thing. So just tell me when you want my slides to,
Thank you for that great introduction into public health and zines. So you can go to the next slide. So before we get into my zine, I guess I'm just going to reiterate a few points that Kin Long and Dr. Morris already kind of said, but so the reason I'm exploring zines as a medium for public health is, well, first it started with, I'm working on my practicum for my master's in public health. And my focus is dental health and education for children and adults in South Korea. And again, this was significantly influenced by seeing and experiencing the lack of information that about basic public health practices that were available to my parents and the larger immigrant and refugee community in my hometown. So I decided to explore the topic of dental health information and its accessibility a little more. So toothbrushing infographics are not really a revolutionary concept. You could see them on posters and sheets of paper at the dentist's office, but they're usually given to the parent who's then expected to kind of relay that information to the child. And it can be a little text heavy or a little dense for a child to understand, or someone who's not a native speaker of whatever language it's in. So rather than having something that's tailored for the child, that's engaging and gives them kind of the autonomy and responsibility over their own health, I wanted to kind of move away from those very plain, very flat modes of public health information dissemination modes. So when I was working with Dr. Morris as a TA, and still am, he introduced me to zines. So I'm still very new to this community, but they come in so many forms. And he's also acting as my advisor for a creative opportunity grant to explore the idea of zines in public health. So I thought it'd be fun to make a version of dental health infographics in the form of the 8-panel zine because it's more tactile than a plain sheet of paper. And I'm working with illustrators because I want the children's one to have that children's book aesthetic, right? I want them to see it as something that's very visually appealing and make it more inviting to flip through and want them to learn from it. And I'm also constructing a companion zine that targets like parents, guardians, adults. So this zine is more focused on supporting the child's dental health. And I'll be producing both zines in English and Korean. While I am focusing more on the international community, it would be amiss if I didn't serve the Korean population while I'm a guest in the country. So I plan to hand out both zines as a part of dental care kits when I present on toothbrushing at a few schools in Korea. And it's going to come in a little goodie bag because who doesn't love a goodie bag? And they'll be shipped to some schools that I don't present at and made available online. We can go to the next one. So both zines are still in draft form. So these are not the final drafts, but the first zine is going to be titled, "I Can Brush My Teeth!" exclamation point. I left it out here, but I wanted to make sure that was clear because it makes it more fun. I wanted the title to be in that first person to kind of give the reader, the child, a sense of ownership of their skills. It's a very basic breakdown of the steps for brushing the teeth. And the artist I'm working with has this layered collage style that I think will give the zine an interesting texture and again have the aesthetic of a children's book. So I'm also trying to limit the amount of text that's on the zine so it's accessible to various age groups and reading levels. We can go to the next one. This is the draft for the zine that's meant for parents. I'm still considering title names, but overall I wanted it to look like a composition book and invoke that feeling of like note-taking. You're kind of back in school learning something, although learning is a lifelong thing, but I'm still in school, so that's the mindset I was in. And in this one, I'm providing some basic information on toothbrushing and toothpaste and for different ages and how to encourage toothbrushing, and just like a few other informative panels. This one's not meant to act like step by step, like the children's zine will. Instead, it's like a culmination of information that parents may need to know or need some clarification on. I know a lot of the things in here, my parents would be like, no one ever told us this. We had no idea this was a thing to look out for when we as their children were younger. So again, I wanted that notebook style because it's a continued learning experience and it's not an exhaustive list of information or unique experience. And that's all I have to share about my zines so far. They are, again, still works in progress. Thank you all very much for listening. And I guess we will take Q&As later because that's how we were said it will be done.